Hi, Dr. Kaminsky.
Hello,
Thank you so much for joining us today.
it is my distinct pleasure.
So, I have a couple of questions to ask you in regards to Parkinson's disease. And so, I guess we should just start off by having you explain yourself and your background and your profession.
Okay, I am a physician and neuropsychiatrist, which means I deal with conditions that affect the brain and express themselves in psychiatric symptoms.
Great. So, because we're talking about Parkinson's, I was hoping you could talk a little bit about what your relationship or experience has been with Parkinson's disease in particular.
Well, Parkinson's disease has several um, different clusters of symptoms. I usually am more interested or more involved with what we call the affective component, which means the mood, the cognitive component, which means the thinking and memory and planning, and also the ability to interact with others, uh, which is part of the larger aspects of um, human behavior that are affected in Parkinson's. Of course, the other aspects of Parkinson's disease have to do with their uh, motor and sensory problems.
Hmm.
Um, but I primarily deal with the psychiatric, psychological, and emotional issues.
Got it. So, if you could explain maybe what some of the symptoms are that you specifically deal with, that would be great.
Well, some aspects of Parkinson's disease can present themselves with a general dulling of the personality. In other words,
Hmm.
the person becomes less and less interested, less and less involved, less and less outgoing, less and less able to experience emotions and to experience um, strong feelings. Many, unfortunately, become increasingly forgetful, and then they may end up being um, demented.
Hmm.
And also, Parkinson patients suffer from depression and from psychosis.
Got it. Those seem like pretty horrible symptoms. Do you know what the causes of these symptoms are or why Parkinson's disease um, manifests itself in certain people? Like what the causes are neurologically and also who tends to get or contract Parkinson's?
Well, there are two types of Parkinson's disease, those that are inherited and come in families, and those are the very, very small minority. And the rest is what we call in medicine idiopathic, meaning we don't actually know why it
Mm.
happens. Um, we know, however, that at a certain area of the brain called um, the basal ganglia, and
Hmm.
especially part called substantia nigra, the neurons that produce dopamine start dying out.
Hmm.
We think we need about 60% of the neurons to die out for Parkinson to start expressing itself.
And
But
dopamine is responsible for what?
well, it depends on what area of the brain or the body we talk about. As you know, the neurotransmitters are different in their effect
Hmm.
by the difference in receptors.
Hmm.
So, in the substantia nigra and the um, area that is the subcortical or the basal ganglia, it really is more involved with the ability to have fine motor movement, coordination, balance, spatial visual, and tactile aspects. Uh, However, in other areas of the cortex, the absence of Parkinson's disease, I'm sorry, of dopamine,
Mm-hmm.
um, can cause lowering in mood,
Mm-hmm.
lowering in um, the ability to make effective decisions, and also, unfortunately, Parkinson's disease patients suffer from psychosis or delusions, hallucinations, but that's more related to the treatment rather than the illness itself.
Thank you. So, speaking of the treatment, is there any cure for the disease or any sorts of treatments that if they don't cure the disease, at least can help the patients with the symptoms?
Well, unfortunately, actually, for most, if not almost all medical conditions, there is no cure. The only treatment that is really curative, absolutely, are antibiotics. Other than that, we usually give symptomatic treatment, and it's also true in neuropsychiatry. Um, the treatment for Parkinson's disease in general is the administration of L-DOPA, which is the precursor of dopamine and turns into dopamine in the brain.
Is that carbidopa levodopa?
Yes,
Okay.
yes. Well, L-DOPA is levodopa.
Ah,
Carbidopa is something that prevents it from having an effect in the periphery because it causes a very strong uh, problem with nausea.
oh, okay. Understood. And this, the L-dopa helps um, with the symptoms because it produces the dopamine.
Yes, but it only helps with the motor symptoms.
Oh,
It doesn't help with the psychiatric symptoms. And with the psychiatric symptoms, we need to address it with symptomatic psychiatric medication, such as antidepressants
mm-hmm.
and antipsychotic. Unfortunately, we still don't have good treatment for the problem with dementia or loss of memory and cognitive deficiencies.
Understood. So this seems like a pretty difficult disease to live with. But is it fatal?
It depends. If it starts what we call early onset, which is under the age of 60, um, then it can shorten one's life. If it starts after the age of 60, what we term um, later onset, it really doesn't shorten necessarily the span of life. The problem is that the quality of life is becoming increasingly compromised. The person becomes increasingly disabled, and the medication are also unfortunately becoming less and less effective as the time goes on.
Mm.
So at the end, the patients usually are unable to swallow anymore and
Oh,
have to be fed through a tube. And I will spare you the gory details,
mm-hmm.
but I guess in a way you could say it's a fatal disease. It certainly kills um, the fun in life.
Yeah. Are you aware at all of any of the current status of research that is being done on this disorder or um, possible medications that are being created?
Yes, I'm very well aware. There are other attempts now to treat Parkinson's disease with more changes to the um, electrical activity of the brain, uh, with deep um, stimulation of the brain, um, with electrodes that are implanted inside the subcortical area or in the vagus nerve. But unfortunately, it hasn't been as successful. There were attempts to try and implant embryonal cells into the area in the brain that is deficient, and it didn't work out well. But I think that now, with the advent of nerve growth factor and the ability of the brain, of the research to provide stem cells and turn them into dopamine producing cells, hopefully there'll be a way of treating the disease at its, at least if not at the cause, but at the mechanism.
Okay, and last question for you, Dr. Kaminsky. Is there any way besides for um, the um, possible cures and preventions coming soon to prevent the disease from occurring now? Or is it kind of just something that happens and you cannot really prevent it?
Well, first of all, it's hard to predict who's going to be suffering from it. It's beyond the scope of our discussion. There are some pre uh, clinical kind of conditions that may be pointing at the future possibility, but right now we don't have genetic studies or anything to tell us who's going to have Parkinson's disease.
Mm-hmm.
So it's impossible to prevent it, and we also don't know how to prevent it nowadays. I have no doubt that within the next 10, 20 years, there'll be a big breakthrough, as there is a big breakthrough now with the improvement in genetic treatments.
Got it. Well, that makes us optimistic for the future. Thank you so much for taking the time out of your busy schedule to do this interview. You're very informative.
Thank you very much. I'm very happy to be helpful.
Have a good night.
Good night to all of you.